Hey guys, so today I thought that I would make a video talking about tips for dealing with confused patients slash dementia patients. Sometimes they're confused and they have dementia, sometimes they're just confused. So excuse me if I'm looking down. I did make a list of points that I wanted to make sure that I covered within this video for you guys. So I will just get right into it. First of all, I just want to say that just because you don't if you don't work in the memory care setting, that does not mean that you will not encounter a confused patient or a patient with dementia. Not everybody who lives within the memory care setting, or who doesn't live within the memory care setting, I should say, doesn't have dementia. I have worked in multiple nursing homes that do not have a quote-unquote memory care unit, but they still have patients who do have dementia. They just might not need like a locked unit type of situation. There are also confused patients that you will encounter within the hospital setting. So, you know, wherever you work, whatever setting you work in, you have the ability to encounter confused slash dementia patients. So point one is arguing is pointless. No matter what it is that you are trying to get across, whatever point you're trying to make, the person is confused, and trying to get them to understand your point of view and where you're coming from and that you're right and they're wrong is it's not going to help, especially if you have like an elderly confused and or combative dementia patient. That can actually make the situation even worse. They could get more combative. They don't understand why you're telling them that it doesn't make sense what you're saying, Miss Brown. Your parents have already died. Someone with dementia, they don't understand those things. They regress, and they don't understand what current time period is. They understand the past. So arguing is pointless. It's only going to make the situation worse, and it can actually lead to combative situations. So point number two is that medications sometimes actually make them worse. So I've worked in nursing homes where a patient becomes confused and or combative, and the first option that people go to is medication. They think that by medicating them that it can help the situation, and a lot of times it does. Like if they give them Ativan or something like that, it calms them down if they're being combative. Sometimes it can help them go to sleep, but there are other medications, like your everyday medications, like antibiotics and things like that, that can make a person more confused. Also, if a person has a UTI, a urinary tract infection, they can actually become more confused just because of that. And I've noticed that's especially true with patients who have dementia. For some reason, they become more combative, more angry, more frustrated. They don't want to interact with you because they have a UTI. And like I said, other medications can also affect the way that a person acts and whether or not they're confused. So point number three would be it's okay to fib or validate their reality. For example, if they tell you that they need to get ready for work, and this person is a 90-year-old woman who hasn't worked in years. She's been retired. She's been living in this nursing home for 5-10 years already. And she suddenly wakes up in the morning and tells you that it's time to go to work and she needs to get ready to go to work. A lot of times when I was working in memory care, we had certain people who would be looking for their parents or their spouse, and we would just tell them, that they're at work right now or they will be back later. It's okay to fib to them just to validate their reality. It's not okay to lie to a patient, just outright lie. But if the person is not connecting with the current reality, then it's okay to not exacerbate the situation by telling them, if they're saying that they're looking for their parents and they can't find their parents, and you tell them that their parents are dead, it's like telling a child that their parents are dead, because that is where these people live, as far as in their mind. They believe that they are a child again. They're looking for their parents. And, you know, if you were a child and you were told that your parents were dead by some random person in this facility with all these old people around, you know, how would you feel? Just think about it that way. How would you feel? So it is okay to fib just to validate their reality. Number 4 is to make priorities, let everything else go, and pick your battles. Because working in memory care, I'm using this as the example of working in memory care because a lot of times you're going to deal with confused and combative people in memory care more often than other settings. So this could be applied to other settings as well, but especially in the memory care setting, it is so important to pick your battles. You have to choose, you know, if somebody's telling you that they don't want to do such and such, they don't want to go to activities because it's time for them to get ready for work. Let them get ready for work, you know, and maybe bring them to a different area and tell them that their ride is going to be there in a little bit. You know, try to have them focus on something else. It is so easy to get so frustrated when somebody has dementia or is confused, but to validate their reality and to not exacerbate the situation by choosing to say inflammatory things that are just going to make it worse. It's better if you just pick your battles, prioritize the care. So obviously you need to make sure that the person is safe and that, you know, they're clean and they're dry and they're not hungry, they've been fed, they have everything that they need. But as long as you have those priorities in mind, the little things don't really matter. Just do your best. So the next one would be, remember that they can't control their behavior. They're not doing it on purpose. They're not being irritating on purpose. A lot of times we feel so rushed as CNAs or caregivers to get everything done that we forget that they have no control over their dementia. They have no control over their confusion. They can't, you know, flip a switch and suddenly everything makes sense to them. You know, when they're being combative, they don't understand, you know, that they don't understand what's going on usually, and that's really why they become combative, is because they don't understand the situation. They don't understand why you want to do the things you want to do to them, and they just simply don't understand. So just reminding yourself that they can't control their behavior sometimes really helps. The next point is reapproach them later if they become combative during care. So I've talked about this in a few other videos as far as what I would do if they either become combative or if they simply refuse. What I will do is I will let the nurse know first of all, and then I will leave them alone to let them calm down and see how they handle things then. But then I will reapproach them at a later time, maybe give them a half an hour, 15, 20 minutes, half an hour, sometimes even an hour. And then I will reapproach them and I will try to change them or, you know, get them to take a shower, whatever it was that they were refusing to do or becoming combative about. And sometimes they just don't want you doing it. Sometimes it's easier if you find somebody else to kind of tag team with you, to where if you've tried a couple times and they're still refusing, send the other person in, and a lot of times that other person will be able to get it done. Not necessarily all the time, but a lot of times they'll be able to help at least get certain things done. Maybe not everything that needs to be done for the person, but they might be able to help you a little bit. So the last point that I wanted to talk about during this video is to take your time and don't rush through care. Rushing someone when you're trying to provide care is only going to make things worse, and a lot of times it makes things 10 times worse because they can understand that you're rushing them. They feel like you're being impatient. They feel like you're kind of being rude. I've had residents tell me in the nursing home before that they've dealt with rude CNAs as far as, you know, they come in, they can tell that the person has an attitude and they just want to try to rush through everything and get on to the next person, and they don't really spend time, you know, engaging in a conversation with them. And I can understand how it's easy to get to that point where you feel like you don't have time to have a conversation with Mrs. Brown. But while you're providing care, you know, you could easily have a conversation, even if it's just small talk. You don't have to sit in there and talk with them for an hour. But while you're providing care, at least have the decency to engage in a conversation, a little bit of small talk. It helps, you know, it helps the resident be more comfortable, and it also helps it to go more smoothly. So that's basically all I had for this video. I hope you guys are, I don't know what I was going to say. I hope you guys enjoyed, but I just wanted to talk about that because I feel like it's important to watch how you deal with people who have dementia and or are confused. So with that being said, I hope these points made sense. If there's any other topics you'd like me to talk about in future videos, be sure to let me know and I will get them filmed for you. And with that being said, I will talk to you guys again in my next video.